Comedian Kathy Griffin announced her lung cancer diagnosis today.
Medical reporter Dina Baer has more on her case and why many think the high-profile cancer battle could help others.
Talking about the ravages of lung cancer brings the disease front and center and reminds people to pay attention to their health. It also shines a spotlight on the need for better treatments. And for those in the lung cancer community, it's a powerful example of how patients are still stigmatized. When news surfaced about Kathy Griffin's stage 1 cancer diagnosis, virtually every report was followed by the revelation the comedian never smoked a day in her life.
We know that 80 or 85% of non-small cell lung cancers, which are the most common form of lung cancers, are in smokers. That still leaves 10 or 15% of people who are never smokers who do develop lung cancer.
While smoking, diet, and weight are all associated with cancer, lung cancer survivors say after a disease diagnosis is never a time to point fingers.
The stigma surrounding lung cancer and the blame culture is pervasive. No other disease has a culture of blame and shame like lung cancer does. And the problem with this stigma is it creates barriers to diagnosis and treatment and quality care. And it also creates barriers to research into other risk factors of lung cancer.
Survivor Jill Feldman is working to change that. She lost both of her parents to lung cancer.
I have the EGFR mutation.
She's been pushing the disease back with surgery and emerging therapies for 12 years. All that time, she's been speaking out. Doctors who treat the disease say education is key to prevention and early diagnosis, but so is a medical focus on expanding care. And with lung cancer, there are a few more options now.
The field of lung cancer treatment is rapidly changing. There are a number of targeted agents that were not available, say, 5 or 10 years ago. They're now available, and that we're seeing some very encouraging, early but encouraging outcomes with. Lung cancer is tough, but the best way to cure it is to catch it early. And when it's caught early through lung cancer screening, like Kathy Griffin had, you give the patients the best chance of beating it.
A low-dose CT scan has been shown to improve survival. Current guidelines call for screening in those who've smoked a pack a day for 30 years and are 55 to 80 years old. But more recent studies suggest there may be a benefit for patients as young as 50 who've smoked a pack a day for 20 years.
You only have to screen about 320 people in order to save one life, which is significantly better than either mammograms or colonoscopies.
Don't ignore a persistent cough, chest pain, shoulder pain, loss of appetite, and weight. Finding disease at an earlier, more treatable stage extends life.
So there is hope.
We have resources to find out more information, including lung cancer screenings, on our website. Back to you.